What is chemotherapy like? This is quite a tough question because there are many different types of chemotherapy. Depending on the type and stage of your cancer, you may have multiple chemotherapy drugs, like a combined protocol, may also be combined with molecular targeted therapy. Your chemotherapy may be a drip, it may be tablets, it could also be a cream. With skin cancer, I think a common chemotherapy is 5-FU cream, 5-fluorouracil cream. You may have a combination of those. With some cancers, you'll have a device that slowly releases chemotherapy. The kind of classic one for colon cancer, which is that drug I just mentioned, 5-FU, that's like a 46-hour release. So you have this bottle and it's got essentially a balloon inside, and the balloon is filled with this chemotherapy drug, and it's attached by a needle into your body, and the balloon slowly deflates, releasing, I think it's like 2 or 3 milliliters per hour into your body. So this is like slow, continuous infusion. So I've had a lot of chemotherapy over the past 7 years of various different kinds. Generally, because I've got late stage cancer, that's been combination chemotherapy, so at least a couple of chemotherapy drugs and molecular targeted drugs as well. And so my chemotherapy, for example, I would go to hospital essentially for like a day and have a series of drips. And then I would leave hospital with one of these chemotherapy devices attached, which would stay with me for 2 days. And then you remove it, or generally get someone to help you remove it, because there's a process to remove it, because you can't just rip out the needle. And then you're free for a while, and then it's time for the next chemotherapy. So there'll be like a cycle of chemotherapy. So you might have a 3 week cycle. You might have a couple of treatments on different cycles. So it may be once every 3 weeks you have a certain drug, and once every 2 weeks you have another drug. You may have some drips at hospital, then followed by a course of tablets, and then nothing for maybe a week, and then back to hospital for the drips. So one protocol I have is TS1 tablets, and it's 2 weeks of tablets. But first you go to hospital for the drip, and I'm having a drip called bevacizumab, which is not chemotherapy, it's a molecular targeted therapy. So that's kind of the mechanics of how it works. Chemotherapy comes with a lot of side effects. These depend on the dose, they depend on the person, they depend on just random stuff that you have no control or awareness of, except sometimes the side effects will be much worse and sometimes they will be quite okay. So I made other videos about the various side effects. But because you're having the chemotherapy on these cycles, and your body somehow kind of understands after a few cycles, you then start to get some of the side effects kind of before, or maybe on the day or the day before the chemo cycle starts. And I don't mean like it's like in your mind and it's tricking you. I mean you genuinely get physical side effects, right? Because of That will be partly because of just human physiology, how it all works. So things like gastrointestinal side effects. I mean, there are many pathways from your brain to your intestines. So knowing you're going for chemo the next day, yeah, your body doesn't like that. But then there's also like the just the time cycle of like the metabolism, how your body's breaking down those chemotherapy drugs. Some chemotherapy drugs are very persistent, so it takes a couple of weeks in your body to break down. Some break down very quickly. So 5-FU, which I mentioned, that has a reasonably long half-life, which means it persists quite a while in your body. Irinotecan, which is another unpleasant chemotherapy drug used for quite a range of cancers. That has quite a short half-life, so it breaks down very quickly. Unfortunately, the side effects persist quite a while. It's very important to keep an eye on the side effects, keep on top of them, report them, all of them, because your nurses and doctors will have things that they can do to reduce the side effects or treatments they can give you for the side effects. Some of those side effects treatments have side effects themselves. So, for example, I was given a steroid, I think it's called Decadron, and that has side effects of it's an appetite enhancer, so you feel hungry all the time, which is extremely unpleasant when you're feeling sick from chemo and have no kind of ability to eat. Bizarrely, it causes like sneezing, which again very unpleasant if you're sneezing for more than a few minutes, particularly if you've recently had surgery. A big side effect of chemo is nausea, which means like feeling sick, and you'll often not be physically sick because there are there's some really good drugs to prevent vomiting, and there are also drugs that reduce or prevent nausea, but nausea is still a really big issue, and it's a very, very hard side effect to cope with. Just always feeling like you're going to be sick. But again, as with all the side effects, you report early, report persistently. If you report a side effect and they give you some treatment for it, tell them if it works, tell them if it doesn't work. Them, I mean the oncologist, the nurses who are treating you. The oncologist may better refer you to someone else to deal with the side effects. So with chemo, you often get skin side effects. So your oncologist may better refer you to a dermatologist who may have some protocols for dealing with the skin side effects. And I say protocol because it may be a multi-drug protocol. You may be given some tablets and some ointments and some creams and told to apply them multiple times a day to deal with a skin rash. With chemo, even if you're getting just one chemo drug at a hospital, it may still involve several drips. You may be given a drip to like clear out the blood vessel. Then you may be given a drip that is maybe an anti-allergy drip and also has some anti-nausea drugs in. Also maybe a steroid as a drip to reduce the chemotherapy-induced fatigue, prevent the chemotherapy-induced fatigue. Then the chemo drug itself, and maybe another drip, short drip to clear out that blood vessel again. So expect multiple drips. In my case, when having chemo with sort of 4 drugs, that may be 7 or 8 drips Fortunately, I don't have anything like that now. But yeah, in a busy hospital, there may be, yeah, you go to your chemo. Before chemo, you need a blood test, maybe a urine test as well, to wait for those results. See the oncologist, who then says, yep, you can do chemotherapy today, or note your potassium level's too low, or liver function's not good, or you've got a lot of inflammation, maybe you've got a cold, so that will show up in a blood test as a CRP, which measures inflammation. So there can be quite a lot of waiting, and then you're given a seat or bed in the chemo ward, and then maybe some waiting for the drugs to arrive. You may some chemo wards will have a pharmacologist there who comes to talk to you about the drugs you're getting, and they'll ask, recent side effects and that kind of thing, or explain about side effects. And then the drugs arrive, and yeah, so it can be, if you're in a busy hospital and you've got a long chemo protocol like I did, it can be a day in the hospital. Yeah, not fun. I strongly believe you should do something enjoyable at chemo in a hospital, and or useful. So I always took something to study, or just films that I wanted to watch on a tablet, or MP3 player load up with podcasts. And always, if I had done something a bit kind of useful, particularly if I had studied something, I felt much better, at least mentally, after the chemo, than if I had just spent a day at the hospital having unpleasant drips and feeling miserable. Okay, I hope that helps. Please add your questions about chemo, and I will make some videos for you, or at least I will answer your questions in a comment if it's a short one. Thanks a lot.